When talking
like,
about
bring
injuries, UFC
They
fighters.
Panama too, Neil Reed.
There you
So
go.
like what for?
Dr. Neil Reardon, who's really,
You know this guy?
he's written so many books and papers on the
Have you done the
benefits
stem
of
cells?
cell. I've done a shitload of them. Yeah.
And what is the like immediate impact?
Oh, it heals soft tissue way better than anything else that I've ever used before.
So like what, for example, what injury did you have that you felt?
The biggest one, I've talked about it before. I apologize if you heard this before, people. I had a rotator cuff tear, a full-length rotator cuff tear, and went to a doctor, went to the UFC's doctor. They sent me to an orthopedic surgeon.
Partial
looks
width,
at my MRI.
but it goes across.
You can't believe I can
but
do
it's
anything.
a partial.
He goes, the tear is gone. Like you just
Maybe
this
what else could
full-length
happen?
rotator cuff tear that
The
was
planes
gonna
of the
need
cut were a
surgery
little different on the
doesn't
initial
exist.
MRI,
scan.
and maybe
Like when I
they
say like my
overcalled
shoulder
a tear,
is better,
and then maybe now
I mean it doesn't
it
bother
shows
me
there's
at
no
all.
tear at all because it's
But
out
for
of
someone to
hand.
say this is the most
I do
astounding thing I've ever
everything.
seen
I
in my
hit the
career.
bag,
Come on. I've seen some really astounding things.
Kettlebells with 70
I saw
pounds.
my-
of
Joe
one of my-
Rogan partial not being tear is not
Maybe for him.
astounding. You know what would be
He's seen
astounding?
a lot
Arm
of-
grew back.
Not
Arm grew back.
That'd be cool.
One thing like, man, maybe
I saw this
shouldn't
guy
be
with a
doing
missing
this.
head
It like
pop
feels
who had a
100%
skin graft
normal.
over his brain that was
And
working.
all
That's
stem cells.
astounding.
That was astounding.
This is the biggest mistake in all of fat grafting and cosmetic surgery. Patients say, how much will survive? That's foolish. Okay. The real question is, how much can I put in? Because in a perfect world, each fat cell and stem cell needs a cell next to it to give it oxygen, nutrient, and blood supply.
Yeah, you
if
need
the
a neighbor,
tissue
you need a
is
friend
this
nearby.
thick, it's going to be double.
The scaffold
it's going to be this
concept,
thick,
kind of what we
right?
talked about,
If
yeah.
there's no scaffold, you can put all this. If you have 100 grams,
floats down gravity.
if you have 100 grams of breast tissue, I can add 100 grams of fat. If you put 400 grams of fat into 100 grams of tissue, only 100 will live. You'll have 300 die. That's a 25% yield. If you put 200 grams in, 50% yield. If you put 100 grams in, 100% yield. It's a very simple equation, and yet everyone gets it wrong. And surgeons are just too lazy to sit there with a patient and explain this concept because it takes a lot of time.
Well, that's why we go to Dan Gould, folks.
When my patients come to me, I say, hey, you want to know the yield?